Hi, today we're going to be going over how to do a dressing changes to the central lines. And central lines can be a couple of places. The first one, it can be in a pick line. This is what a pick line would look like. This is a central line, and sometimes it's located right here. Sometimes it's located up in the neck or on the base of the neck. And the other option is your portacath, your central line. So for this demo, we're going to first start out with is the pick line. And that requires we're going to do a changing of your dressing on a pick line. So the first thing what I do is I would check the doctor's order, make sure it's required to be changed, and look at this policy of the facility and how often they are required to be changed. So the next thing I would do is I wash my hands. And I would gather my equipment prior to this, which I need a pick line dressing change kit, and also I need a pick line stabilization device. Okay, so I would grab those two and I would go into the patient's room and tell, I'm Dawn, I'm your nurse, and today it is time to change the dressing on your pick line. And I would ask him to verify his name and his date of birth. And then I would set up a sterile field. This has to be in a sterile field because this is a large catheter that's in a major vein. So it requires it to be in a sterile technique to change this dressing. So I would find and clear off like a table, wash it down, and then I would open up my kit. I'd open it up completely. The first thing I need to take out would be my mask. And some facilities require you to also put a mask on your patient. So I would be putting a mask on myself and making sure I had an extra mask for my patient. Next thing I want to take out is my gloves, and I'm going to set them over here because I'm going to put them on a little bit. And then, that's all. Then I'm going to grab my gloves. Okay, so I'm going to grab a pair of gloves to remove the old dressing. So I'll put my gloves on. Okay. So what was same thing like we do with the IV, we start to pick up all four lines, all four quarters, and stabilizing the catheter, the pick line here. So we're picking up all four corners. While we're stabilizing. Okay, so this pick line is secured to a device. So we want to just slip off the transparent dressing. Okay, we'll take that off first and we'll check it over, check for any drainage on it, and discard it. So the next thing we need to do is remove this pick line safety stabilization device. And how you do that is that they have two clamps that you need to open up, and you would snap those open. And again, you want to keep stabilizing your pick line. Some doctors will do is they will suture in their pick lines, and some doctors don't. So you do have to check to see if it's sutured in. And prior to even working with your pick line, you want to take a look at where your pick line is sitting. The catheters are marked like at 4, 5, 6 centimeters. So you want to check to see where your catheter is sitting at prior to you starting to remove the dressings. So it's still sitting at a 4. So what we're going to do then, we opened up the clamp. We're going to take out the catheter out of the device and peel up the device. And when you're working with Mr. Chester Chest, make sure you have him powdered. because this will not come off if he is not powdered. And then you just bought yourself a Chester chest. And this is really sticky. These really stick real well. I'm going to take my gloves off to get this. Okay, so again, please make sure you've got really good powder on him before you put your device on, or you won't get it off. Okay, so that is sitting there, and now what we need to do is we need to gown up, or put our gloves on, down our gloves. We'd wash our hands first, and then put on our sterile gloves. The next thing we would do is open and have a sterile field. And we'll take out our ChloraPrep and we'll squeeze this. So now what we're going to do is we're going to scrub up and down and back and forth. Okay, and then we're going to throw that away. We're going to take our tape out. So each time you do a dressing change on a PICC line, especially when they are brand new, you are required to measure your PICC line. You need to measure the diameter of the arm to see if there's been a size change from the previous change. So you would take out and you would measure the diameter right where the insertion site. In some pieces they go an inch above the insertion site, they measure, and they also go an inch below the insertion site for measurements to make sure that we're not having fluid buildup in that tissue. Okay, then the next thing we need to do is to take out, we'd open up our stabilization kit, and we should have done that prior to. So we'd open that up and we would grab out our kit, but I need to put powder on him, so again that wouldn't be part of the demonstration or part of the real one, but we have to with Mr. Chester Chest. So then we would grab our stabilization device and we would, again, stabilizing our PICC line. Again, it can be sutured in or not, making sure that it's still at the insertion site of a 4, and we'd pull the one side out and then we'd pull the second side out. Then what we do is then we would set this into the little clips here, and then we would clamp it. Okay, and once we have that set in place, Then the next thing we need to do is take our OpSite and secure it. So then the next thing we do is we add an OpSite to this. And with Chester Chest, the OpSites don't look real pretty because of the powder. So try to make it smooth in real life. You want to make that really a smooth appliance to your patient's skin. No wrinkles. As much as you can. Okay. So then after that, you need to take out your label and you need to label this. You need to put the date and the type, the needle size, which you will get from the chart, your initials, and dressing change. If you were putting a catheter in, those are what you would put in, the date, the type, the size, needle, and your initials. But dressing change, you just need on your sticker your date and your initial. So you would set that up here. Okay, again, not on the insertion site. Okay. Then you would remove your gloves, clean up, and then throw everything away. Then you would document in your chart, change PICC line on the right forearm, and the date and time and how the patient tolerated it.